Hassan is an asthma patient and the physician wants to know if the medication is effective for his condition. He is going to do a spirometry using Vitalograph. But what is a spirometry and what is Vitalograph? Spirometry is a test used to assess lungs function by measuring how much air you inhale and exhale and how quickly you exhale. And for Vitalograph is a spirometer which can calculate forced vital capacity FVC and forced expiratory volume in 1 second, FEV1. It contains a bellow which will expand with exhalation and move the pin, and there is a motor that will move with exhalation to record time and volume on the paper. Let's go back to our patient Hassan. He arrived to the PFT lab and the RT welcomed him and start doing the procedure. First step is hand hygiene and wearing gloves for infection control. Second step is checking for Fred safe. Every letter in Fred safe is the starter letter of another word. For example, F for flu, R for restrictive clothing, etc. Third step, take a disposable mouthpiece or bacterial filter and attach it to the main tubing. Fourth step is turning on the device and placing a paper on the motor and make sure that the pen is on the starting point. And then activate the motor switch. Fifth step, from main menu navigate to test. Then, enter room temperature and patient data. Then select FVC maneuver. The device is ready for the test. Sixth step, explain the procedure and have the patient sit upright with their back supported. Seventh step, instruct the patient to put the nasal clip and then take a maximal inspiration and exhale as quickly and forcefully as possible until the lungs are completely empty. After the procedure, the screen will show 5 results: FVC, FEV1, FEV1 over FVC, peak expiratory flow and FEF 25%, 75%. It will show predicted value, measured value, and the percentage, and if you decide to repeat the test it will show last trial and the best value measured. For the results we can either calculate it or taking the values from the device. For the calculation we can take 2 measurements from the paper. First one is FEV1, which is the volume crossed with the first second, and the second thing is FVC, which is the highest volume reached by patient. Dividing both will give us FEV1 over FVC percentage. All that calculation is when the graph is good. But what if the patient hesitated or did not do all effort from the start? Here comes the calculation of extrapolated volume. When we have a graph similar to the shown one, we should draw a line at the steepest area till it crosses with time. Then, we should calculate the volume behind the line. If the volume is more than 150 milliliters or 5% of the total FVC, which one is bigger, we will reject the trial. If not, we make the point where the extrapolated line cross the new zero and start our calculations from there. For analysis, if the FEV1 over FVC percentage is less than 70%, it considered obstruction, otherwise normal or restrictive. Then we should check for restriction. If the FVC measured over FVC predicted is less than 80%, it is considered restriction. And we should check the severity by the shown table.